Hi, everybody. Welcome to this edition of Iredell-Statesville Schools Ed Talks. Our guest today is Ms. Kelly Marcy, who is the Executive Director of Student Services. Kelly, good morning. Welcome to the show.
Thank you. Hello.
We appreciate you being here, and I'm anxious for people to hear about what you do and the massive department that you run for our school system. Student Services encompasses a lot of different career opportunities within the school system, and you guys do valuable work within the school system. But a lot of people are shocked when they hear that you're in charge of all of our guidance counselors, all of our SAP coordinators, which is our student assistance program coordinators, our social workers, and our nurses. And so you supervise.
And grants. A lot of grants too.
Yes. So you do supervise a lot of different people within the school system. I wonder if you could take just a minute and tell us why is student services so important to a traditional educational experience, and the work that you do actually supports kids so that they can be successful academically?
Well, one of the things when I think about nursing, I think about all the students that come to school who have different medical conditions, and some of those medical conditions are something that they struggle with during the day, and so having the nursing support to make sure some of those health needs are covered, and reaching out to the families and supporting the families and the students in the classroom. Without the nurses there, that would leave a pretty big gap in supporting those students. The counselors and the SAPs really provide that emotional support to the students and families. And a lot of preventive services and intervention services that if they didn't have, a lot of those kinds of, issues can impact, somebody's ability to really focus in the classroom and those kinds of things. Our social workers, we have 2 of them for the whole entire district, and they really help with attendance and making sure that they remove barriers for kids to get to school on time, and be engaged. So it's a gigantic supportive system to kind of the curriculum side.
Let's talk about the nurses just a little bit. I know, having worked in school operations myself, that there are a lot of children in the school system that have chronic health issues.
Yes.
There's a lot of kids that come to school and have to have medication throughout the day. There's lots of screenings that our nurses do. Could you describe some of the duties and responsibilities that the nurses have throughout the district?
Well, I think about it kind of throughout the school year. So in the beginning of the school year, one of the things that they scramble the first 30, 45 days of the school is making sure that immunizations are up to date, that the students come to school with the proper immunizations, along with kindergarten health assessments. All students, when they come into kindergarten, there has to be a health assessment. So they are responsible for making sure that all the students have within that 30-day time frame the appropriate immunizations along with those health assessments. The other piece that they do is that if there is medication that needs to be taken in school, then they have to make sure that there's doctor's orders, that it's in a locked stored place, that they train staff to administer that medication, that documentation. Then we also have students who have conditions such as diabetes, who if they're not able to check their own blood sugars and those and administer insulin, that's something usually from K3 that we do for the students. And sometimes, some students' diabetes is pretty significant and pretty serious cases that they spend a lot of time making sure the students, are safe in that way. We also have students who are tube fed. We have students who have catheters. So if the nurse is not in the school that day, part of their piece is they have to delegate and train other staff people to perform, a catheterization and that. So the other big piece, which I think is one of the most valuable pieces that the nurses provide, is case management. That is reaching out to doctors' offices and making sure that, and which assists the family in making sure that they have the correct doctor's orders, making sure that families can get set up with the right providers, making sure that if they're noticing different symptoms in the school that, with permission, contacting the providers and getting that easy access to them to make sure that they are providing that bridge between the school and, the community medical providers.
Kelly, what does the state recommend as a ratio of nurses to students in a school? Do you happen to know that?
I don't, but I would, again, I don't have the exact data on it, but most of the school systems around us, it's one nurse per school. I can imagine, I remember, when I was growing up, we didn't have a nurse that just split time. And, our rate of chronic health conditions has increased since the time that I was in school. It's typical for kids to have pretty significant allergies and diabetes and those pieces that need to be managed. But I know in a lot of our surrounding counties, it's one nurse per school, and we don't have that. Most of our nurses split between 3 schools.
Yeah, you have 15?
I have 18 nurses.
18 nurses serving 36 schools.
36 schools.
Yeah. So woefully understaffed. Yeah.
I really 17 17 nurses and 1 lead nurse who a nurse can only evaluate a nurse. So as to make sure that all those processes and policies and guidelines are taken
And
care
some
of.
of those are grant-paid positions. Is that correct?
One of them is through what's called SNFI, which is a school health funding initiative, that the health department receives money and provides us some funds to pay for most of one person's position.
Right. Okay. Social workers, I know you said earlier we have 2 social workers serving the entire school system.
Yep.
We cut that budget 60% a few years ago, and so we are down 3 social workers. And unfortunately, from my perspective as superintendent, that's been difficult to watch because I have seen our attendance in the district decrease from, we used to be ranked 8th in the state of North Carolina. I think this year we're 45th in student attendance. And so we depend on those social workers to work with our families that are having all types of issues that impact student attendance. Talk to us a little bit about what those folks do day in and day out. And if you could mention the partnership that we had with the court system on truancy court.
Right. So in the past, we had 5 social workers, and those 5 social workers concentrated on attendance in the elementary schools. Along with that, we had an SAP, a Student Assistance Program coordinator, at each middle school and high school. So the SAPs and the social workers managed those attendance processes and making sure that students were following the compulsory attendance law and then assisting them with any barriers, removing any barriers for them to get to school. So since those positions were cut, we're down to 6 SAPs. So they're splitting between schools. So there is nobody that's managing attendance other than, trying to just internal staff at the schools with everything else on their plate. And my 2 social workers handle 8 really high needs elementary schools in terms of attendance. I actually just looked at the data yesterday. So in 2014-15, we had 4,500 kids across the district with 6 or more unexcused absences.
4,500.
And that amount was much less back in 2009-10, when we had more social workers and we were fully staffed.
Right.
One of the processes that the social workers do is, when we follow the compulsory attendance law, certain regulatory letters go out. That's just from the state,
Right.
3, 6. But at 10 unexcused absences, that's when they really begin to meet with the family, look at interventions they can provide to help the student get back in school, because sometimes it's the student refuses to go to school. We need to kind of look at that as to why they're refusing to go to school. Sometimes the parents have a hard time getting that student to go to school. Sometimes the adult lets the student stay home from school too much, so we kind of help them with that. When that is not successful, then we do have a partnership with the Iredell County court system, that instead of having to wait forever to go to district court and get on that docket, we have a truancy court that's held in Iredell County District Court with a judge, and Mooresville City Schools also participates in that, where that court is just for compulsory attendance issues.
Yeah, and if I remember correctly, I think ISS is one of the first districts in the state to have a partnership like that with the local court system.
Yeah.
But without the boots on the ground, without the social workers in the schools doing that work,
It's that we're in jeopardy of losing that and having to go back to district court. And, unfortunately, we used to be able to catch it early. So you could really ramp up those interventions at 10, 15 unexcused. Now, unfortunately, we have students at 30 and 40 unexcused absences and more who we just don't have the manpower to do the kind of work that we need to do and to catch it before it gets out of control.
I know another program that you administer is the SAP program, the Student Assistance Program. At one time, I remember that program as being a model for the state of North Carolina. We had a full-time SAP coordinator in each of our middle and high schools. That is a licensed mental health worker who would go into the school and set up what was called a core team and get teacher volunteers to serve and manage groups of kids. So let's talk a little bit about SAP, what it was, what it looks like now, because that program has been cut 50%. So all of them share schools now, and they're all being paid for out of a grant that will expire in December.
Right.
So tell us a little bit the concept behind SAP and the mental health component.
Yeah, so the idea behind the Student Assistance Program Coordinator, again, it goes back to intervention and prevention. So the SAP coordinator would, certainly provide prevention, a lot of substance abuse prevention, kind of school-wide efforts to provide information and resources to students, that kind of thing, around mental health needs, substance abuse needs. When students are exhibiting a little more difficulty, and it could just be a relationship issue, it could be a family issue, it could be bullying, could be some depression, could be using substances, then the student is referred, could be self-referred, could be referred by the parent, could be referred by the staff to what's called a core team. And the core team is made up of a group of staff who volunteer in that school along with the Student Assistance Program Coordinator to really intensively support that student. Staff person is assigned as a case manager to develop a relationship with the student, check in with the student, and they begin to provide services. That could be meeting with the student, this SAP meeting with the student. It could be referring the student to outside services, to any programs, and through those interventions, then track if things are getting better. So that's the way it's supposed to run. But now we have 6 SAPs, so they split schools. And with them splitting schools, they really have a hard time doing the kind of intervention and prevention that kind of needs to happen. What ends up happening is they're at one school for 2 days and then another school for 3 days. And so by the time they get to that second school, there's a list of issues that need to be taken care of. So it's sort of turned into more like of a crisis manager versus kind of laying that foundational piece of prevention. And SAPs did do crisis work, but they were on campus all day, so that's not the only thing that they did. They should run groups and individual, but they really provide a valuable service even now, though, with that crisis work, because there's no one else to do that.
Right. Absolutely. Well, I remember as a classroom teacher when I was at South, I served on core team. And I remember working with some of the kids and just having that adult to intervene with the child and listen to them about an issue. It could be something, maybe they've had a death in their family. Maybe they've got issues going on with some type of personal crisis, a bullying incident or something of that nature. But just having one adult to intervene and listen to that child and show that you care made a big difference for a lot of our kids.
Mentoring.
We hear a lot today about bullying in schools, and I know that your department does a lot of our training. We do have an anti-bullying policy, and we train our staff on what bullying looks like and the definition and what the intervention should look like. Talk to us about that a little bit.
So every school is required to train all their teachers every year on the bullying legislation. What is the definition of bullying? What does it look like? And what is staff's responsibility to respond? We also train all faculty at all schools yearly, along with training students, providing professional development to students and activities and those kinds of things to help them understand what bullying is and what bullying isn't, and what to do if you see bullying happen. Because the biggest way to sort of combat bullying in a school is changing that culture where standing up and being a bystander, being an active bystander, is going to shape and change that culture. And so really trying to lay a good culture and climate so that it makes it easy for the bystander to say to a kid, hey, that's not cool, or I'm not participating in that. And sort of changing that culture. That's difficult. That's difficult for a lot of adolescents because they don't want to be a snitch. They don't want to have a bully turn on them, those kinds of pieces, but we still do that. Right. So we do provide training and different resources. And we do have an online bullying reporting system. So not only do students, verbally tell someone that something happened or staff notice something, we also have a way to, kids can anonymously or adults can anonymously, or a parent can let someone know electronically that something's occurring, and we investigate that. And we have processes for investigation and certain documentation ways. And if we do determine that someone is bullied, then always we have to do a safety plan. And a safety plan includes what do we do how do we do our best to ensure that this doesn't happen again? Does that mean that we change schedules? Does it mean we change ways the student comes into the building? Does it mean that there's more supervision for the student who is bullying? Those pieces. So.
Well, I think that's some of the most important work that you guys do because bullying is an epidemic across the entire United States, and it's particularly with the social media element to it today, it's just taken on a whole new dynamics. Now, you're busy running all of those departments, but you are also our grants manager, and you have written and you have procured several major grants for this district, and so that is another component to your work. And maybe we can come back one day and talk about some of those, but just real quickly to close out the program, Kelly, you've just done phenomenal work in securing grants for us. And I know the I-3 grant, I think we were one of 7 school districts in the United States to receive that grant. And then a few years later, we got the Impact grant. Both of those were from the U.S. Department of Ed. The Impact grant, I think we were one of 16 school systems. And if I'm not mistaken, I think we were the only school system to receive both.
Yes, right.
And so just kudos to you for what you've done there. You've brought millions of dollars into this school system. And it's done some pretty amazing things over the years. So that's something you should be very proud of.
Thank you.
And that's just icing on the cake. That's what you do those kinds of things when you're not busy running your real job. Well,
grants are fun.
Yeah, well, you're good at it. It really has been a blessing to us. Well, Kelly, thank you again for talking about your department, and please accept my thanks for what you do, you and all of your staff members. I tell people that it is some of the best preventive work that we do comes out of your department.
Thank you.
And
we're very good people in our department.
We're very proud of you.
Okay, thank you.
Well, thank you for watching today. If you would like more information about student services, you can certainly visit our website. There is a link there that will give you much more detail about the great work that's taking place in student services. Thank you.